Welcome to Motors and Medicine. On today's episode, I'm going to be talking about strep throat. Now, many of you know what strep throat means or what having strep means. It's basically a very contagious infection of the throat. We're going to get into all the particulars here in a moment, but essentially, it's an infection that's been around for a really long time, plaguing patients varying in ages from infants all the way to adults. This particular year, strep throat has actually become pretty prevalent, and there's also been an issue with antibiotic availability to treat strep throat. So I'm going to go over some of the basics to start with, and then we'll kind of get into some other information that's pertinent to strep throat, especially strep throat this particular year. So strep throat, what is it? Well, it's an infection of the throat caused by a bacteria called Streptococcus. Typically, we call it or regroup it as group A strep. There are actually variations of strep. There are many different groups of strep, a lot of different strains of strep. The most common causing the throat infection is group A strep. And it's typically detected by doing a swab, rapid strep test. Sometimes you can do a swab of the throat and culture it to do a confirmatory test. But for the most part, doing a rapid test in a clinic is the most accurate way to do it, the quickest way to do it. And as far as accuracy goes, it's got a pretty good sensitivity. We're looking at probably 94% accuracy on that particular test. There are some cases where you need to do a confirmatory culture just to make sure you're dealing with the right kind of strep. However, for the most part, the rapid strep test works pretty well. Now, as far as strep is concerned, it's contracted by droplet transmission. So, of course, if somebody coughs on you who happens to have the infection, if you share, like, say, a glass of water or the same soda can or whatever, you can spread it that way. And, of course, direct contact. So if you're touching things, sharing foods, that kind of stuff, you're definitely going to spread it that way. Typical incubation period for strep is about 3 to 5 days. It's pretty quick. And then, excuse me, once you've been infected with it and you've gone past that incubation phase and you start to experience the symptoms, well, the symptoms typically are as follows. You start having sore throat, scratchy throat, redness in your throat, swelling. If you have tonsils, you can develop a lot of swelling and redness on the tonsils along with some depositions of these little bacterial pockets. On top of that, you may experience some headache, perhaps some fever. And then if you're a patient with strep and you happen to be a younger patient, say between toddler and about 10 to 12 years of age, stomach pain is actually very common, as is nausea and perhaps vomiting. But stomach pain and nausea are very classic hallmark of children age strep infections. So the main thing that here we want to cover is, well, how do we prevent the spread? Number one. Number two, how do we treat it? Number three, what are we treating it with? And number four, how effective are the treatments? So let's start at the beginning. Typically, when you experience these symptoms and you either have a known infection or rather you have a known exposure to somebody who definitely had that test, obviously it's a no-brainer. Go to the clinic, get tested, and then you're going to be given an option as far as treatment is concerned. Now, there are a few caveats here when you're dealing with strep. The first being, if you're of a certain age and you have strep, strep is one of those infections where, because it is caused by bacteria, you really don't want to sit on it too long. The main reason being that strep can have a few unwanted side effects. The first being, in children, you can develop what's called scarlatina or scarlet fever. And that's where the strep infection has spread beyond the throat and gotten into your other parts of the body. In some cases, you'll obviously have rash, but in other cases, you can develop something where you can develop strep into your joints. And that's where if a strep infection in a child especially went undiagnosed and over time started to slowly improve, but not quite got eliminated. Or in a separate scenario, if you did get treated, but you didn't complete the course of treatment or antibiotics, and we'll get into that in a moment, and you had a latent infection or an infection that just never completely was eradicated, well, now you've got strep that has spread into, say, joints. And that's a very painful type of strep because it can cause joint pain and it can have other detrimental side effects. Problem is once strep starts to spread beyond the throat itself, we worry about things like rheumatic fever, where strep will start to vegetate in and around the valves of the heart, causing valvular disorders. And so you start to end up with heart murmurs and things like that. So that's why if a child has contracted strep, or if you have any suspicion that they have strep, take them to the clinic, get tested, and get the appropriate treatment, okay? Now, how do we prevent strep in the first place? Good hand hygiene, washing hands, don't share foods, don't share drinks, and try to stay away from people who are exhibiting certain types of symptoms, especially sore throat or stomach pain. Now, how are we treating it? Well, you go to the clinic, you get that rapid test, or the culture, or both. Once you know that you've got that diagnosis, the first and foremost option given to most people is an antibiotic called amoxicillin. Now, there are some people who have allergies to amoxicillin, and there are other alternatives that will work just as well. But amoxicillin tends to be the first and foremost top-of-the-line choice. It's well-studied, it's well-tolerated, it has very few side effects. So taking the antibiotic is important because I just mentioned, you don't want to end up with things like strep in the joints or rheumatic fever or anything like that. So when you're given a course of antibiotics, the important thing to remember is that you need to take the antibiotics as prescribed, which means that if you're given a 10-day or 12-day course or even a 14-day course, you got to take every single pill until they are gone. One of the problems that we face and that we've been facing for many years now in medicine is drug resistance, or antibiotic drug resistance to be more specific. Antibiotics are starting to lose their efficacy against certain bacteria and certain strains of bacteria. And so these bacteria are becoming resistant to them because people are not taking the course of antibiotic for the correct amount of time, finishing out the course of antibiotics. And so these antibiotics are losing effect because the bacteria are starting to kind of mutate, become a little bit more resistant to them, and they're becoming more prevalent and harder to treat. So it is of utmost importance to take the antibiotic through its entire course. Whether you start to feel better or not, you have to finish it. Whether you're a child, a teenager, an adult, it doesn't matter. You have to finish the antibiotic in its entirety. Now, one of the issues that we're facing this particular season is a shortage of amoxicillin because of production and supply and a lot of other issues that we've had with, I guess some of it pandemic related, some of it just production related, some of it inflationary related. But amoxicillin is not being produced to the point where it was in the past. The demand has gone up for amoxicillin. Not to mention when people were wearing masks, strep infections had really been reduced greatly. Now that people are no longer wearing masks, those bacteria are starting to affect people a lot more. And so this is something that we're dealing with. It's important that if you can, try to find an alternative to amoxicillin. Obviously, for children, it's best to get the amoxicillin just because it's so well studied and tolerated. But because of the shortage, there may be another alternative that may be necessitated to avoid that problem, because you don't want to put off getting the treatment, nor do you want to put off being treated at all. So that's something to consider. Now, something important again that I mentioned earlier about antibiotic use. If you're going to be taking an antibiotic, you absolutely have to finish the course. So that's the first thing that I mentioned earlier. Finish the course in its entirety. But the thing to consider is that some antibiotics work better than others. So even though amoxicillin is the drug of choice for most strep infections, there are certain people, just because of their biology, that will either react better with a different type of antibiotic, a different classification of antibiotic. And so if you start taking amoxicillin and you are not seeing an improvement within 2 to 3 days, you may need to go back to the doctor's office and say, hey, this isn't working. We may need to switch to something else. I used to see that quite a bit with patients where I would start them with amoxicillin. And about 3 days later, I'd say, call me, let me know, let the clinic know if you're not improving. And they were not improving in some cases. And I would either have to switch them to either Augmentin, which is amoxicillin mixed with another antibiotic ingredient called clavulanic acid, or I'd have to switch to something totally different, like erythromycin or azithromycin or something like that. The point is that some antibiotics or some medications work better in some people than they do in others. So that's something to consider when you're being treated for an infection, whether it's strep or not. And then, again, the important thing here, besides taking the course all the way through, is to remember that antibiotics have other side effects. And one of these side effects I've mentioned in a past video, and that is that if you take an antibiotic, you will disrupt the microbiome levels in your gut. And we all know that your gut health and your microbiome level is very important for maintaining proper health and proper digestion and proper immunity. So keep in mind that when you take an antibiotic, you will be killing off a lot of the good bacteria in your guts. And so it's one of those sacrifices that have to be made to prevent something like strep from becoming a more detrimental infection like a strep in the joints or rheumatic fever where you get the valve damage in your heart. But just remember that if you're going to be on an antibiotic, it's wise to take some type of probiotic at the same time to help mitigate some of that loss of natural bacterial gut flora. And sometimes it's wise just to be taking something like a yogurt every day that you're taking the antibiotic, drinking plenty of fluids, and making sure that you're taking the antibiotic at the right time frame. If it's dosed twice daily, make sure that you're separating it by a certain amount of time. That will give your gut a chance to not get so disrupted by the antibiotic in the first place. So hopefully this information was beneficial. Like always, I appreciate your guys' support. Please hit the thumbs up button if you like this content. And of course, remember to hit the subscribe button if you haven't. Many of you haven't. It'll help the channel grow. It'll help me to continue to put out content. And then until next time, I'll get back into the cars. We're going to be doing some installs on the Bronco. And hopefully you guys will look forward to those videos. So until next time, this is Motors and Medicine signing off. Thanks.